So what we have here is a nice artery to show the progression of plaque as it develops in the arterial system. So first thing we get to look at is what a normal arterial wall looks like. This dark red layer that we see here actually represents the endothelium. And the endothelium becomes inflamed. That's when we start to run into some problems. Our main objective to prevent heart attack, stroke, is to make sure that the endothelial wall doesn't become inflamed. Now, there are various illnesses that can cause that: high blood pressure, diabetes, gout, rheumatoid arthritis, lupus, and various others. Whenever there is inflammation, white blood cells will go here to try and cool it off, and in doing so, they'll actually get a little fatty streak that starts to develop. As that starts to accumulate, if the problem is not corrected, we're talking about blood pressure that's untreated over years, or cholesterol that's untreated over years, it'll continue to develop, and what we get is a plaque formation. And the plaque actually builds in the outer wall before it starts to affect the inner wall. And in doing so, it pushes the two walls together, and later on, it can lead to stenosis and a lack of blood flow. Whenever you get this entire lumen, or the area which blood flows through, blocked up, that's where we get our heart attacks. If a piece of this soft plaque tends to break off, that's where we get our strokes from. So again, our main objective is to keep your arteries this way, to keep them clear, number one, and if we do start to see some of this inflammation through our testing, to make sure that we prevent it as quickly as possible.
So your advanced testing can help identify that by some
Certainly.
of those methods.
Our advanced testing most often catches people that have risk for heart attack or stroke, even diabetes, on average 10 or 15 years ahead of time. Our younger patient population even more so, but identifying some risks that aren't otherwise identified in the regular lipid panel, we can certainly do some things to make sure that we're taking a proactive approach.